Why does Khloe Kardashian look so different? Has she had plastic surgery? Well, I've got the answers for you from a real plastic surgeon on this video today. We all know that the Kardashians are into their plastic surgery. And there's one Kardashian that may have changed more than all of the rest, and that is Khloe. So in this video, we are going to take a look at Khloe Kardashian over the years. What plastic surgery do I think she's had done? Now, I need to start this video by emphasizing that I'm not her plastic surgeon. I'm not her doctor. I've never met Khloe before, so this is all my opinion based off of photographs and videos of Khloe. So let's start by looking at Khloe back in 2008. At the time, she was 24 years old. She had just recently hit the scene, and she was a very pretty gal. And this is what I think is, in general, the natural Khloe Kardashian. If you look at photographs of when she was a teenager, she doesn't look all that different from back then. But now let's take a peek at her a couple years later. Now this is a picture of Khloe Kardashian back in 2011. She was 27 years old. She was very famous by now. She looks fantastic, and I think she may have had her lips done. Now she's always had nice full lips, but if you look very closely at this picture, her lips appear to be a bit outlined. Now it's possible that this could be just good makeup, but it's also possible it could be a sign of well-performed lip injections. Now, other than that, I don't think I see any major surgery here. I think she still looks fairly natural at this time. Now let's fast forward to 2013. She's 29 years old, and if you look closely, her face looks a bit more chiseled, a bit more contoured than it used to. It looks a bit thinner. Now, I do think it's possible she had some submental liposuction, which is liposuction under the chin, to help get rid of a little extra fat potentially that she had there. It's also possible she's had some Botox injections to the masseter muscles. If we inject Botox into that muscle, we can cause that muscle to weaken. It can then atrophy or get smaller as time goes on. This can then cause that part of the face, the jawline, to look thinner. Also, take a look at her eyebrows. Her eyebrows look a little more arched than they did before. I do think it's possible she started having Botox injections around this time to smooth out her forehead and to give her the classic Botox brow where she gets a nice lift and an elevation of the arch of the eyebrows. But overall, she still looks fantastic. I think everything that she has had at this time looks very natural. This is the point, in my opinion, where I would have said, hey, look, you look fantastic. Let's just, if we do anything, let's just do little tweaks, but I don't think you need anything else. You look like yourself, you look beautiful, you don't need anything major. And then 2 years go by and she looks a bit different. Take a look at this picture of her from 2015. Now she is 31 years old, and if you look closely, her nose looks a bit different. Now, I think it's possible that many years before that, even before she got real famous, she may have had a very subtle and well-done nose job. Well, I do believe that between 2013 and 2015, she either had her second or her first rhinoplasty. And if you look at her nose, I believe her nose looks a bit thinner. There also looks like there's a minor amount of irregularity, which could be from possible surgery, possible scar tissue, but the nose to me looks like it's been thinned. I also believe that it's possible she's still doing Botox into her forehead, into her masseter muscles to keep thinning that jawline. And I also think she may have had some filler injected into her cheeks. So her face is starting to reshape a bit. It's starting to thin, it's starting to contour, and I do believe that she is a glamorous, beautiful woman, whether she's had any work done or not. Well, now let's fast forward to the present, and Khloe looks quite a bit different than she used to. Now, there is a ton of speculation out there of what she may have had done. This is my opinion. I do believe she may have undergone a second, or if she had one way a long time ago, a third rhinoplasty. Her nose does look thinner than it did before, and this is, I think, is the main reason why she looks so different than she may have in the past. When the shape of the nose changes, it can dramatically impact how a person looks. There was a celebrity long ago, Jennifer Grey, who was in Dirty Dancing, and she had a very characteristic bump on her nose. Well, after that movie made it big, at one point she had her nose done and the bump taken off, and people couldn't really recognize her anymore. So when you really reduce the size of your nose, when you change the nose, it can really profoundly impact how a person looks. I also believe she may have had a brow lift done and possibly an upper eyelid lift or an upper blepharoplasty. Her brows look like they're in a bit of a higher position, her eyes look a bit more open, and that can also really profoundly change how a person looks. And I also believe she may have had a buccal fat removal. Now this is a very niche procedure where you go inside the mouth and remove a little chunk of fat from the cheek hollows on both sides. It's a very popular procedure out in Beverly Hills. I actually do a lot of these. I learned how to do it 15 years ago in Beverly Hills, and I've been doing it in my practice in Detroit for the last 15 years since then. This operation, which takes literally a half hour, can create thinning of the cheek hollows, creating a bit more of a contoured cheek. So if her face looks thinner to you, this could be one reason why. I also think that she is probably continuing with her injections, Botox in the forehead, into the masseter muscles, filler into the cheeks, into the lips. The final surgery I think she may have had done, although it's tough to say, is a cheek lift. Her cheeks do look a bit higher, they look lifted. Now sometimes filler can do that, but there's also operations that can do that as well. So if I had to summarize, this is a list of all the procedures and operations that I think Khloe has had done. My advice to her now, especially because she's a young woman still, is to leave well enough alone. A few injections here and there, not a bad idea, but I really don't think she needs to have any further operations. She looks beautiful, and at this point, any further surgery may actually make her look more done and less like Khloe. So that's what I think about Khloe. But what about Kendall Jenner? Well, take a peek at this video right up here where I dissect down Kendall Jenner's plastic surgery, what I think she has had over the years. And if you've been enjoying these videos, please hit the subscribe button, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.